Today we are going to see about muscarinic receptor blocking agents. So before moving on to the topic, we must know what are muscarinic receptors and their location and their function. Then only we will be knowing what are the exact mechanism of muscarinic receptors and how these muscarinic receptor blocking agents act. So let us move on to the topic. So M1, M2, M3, M4 and M5 are the 5 muscarinic receptors which are located in, you can remember using the mnemonic C huge cage. You can remember using this mnemonic, and S stands for smooth muscle, and E stands for eye, and another E stands for endocrine and endothelial. And next, huge M2 receptors are present in heart, and you must write this from the right to left. So C huge cage, that is M3 receptors is C, and smooth muscle eye, endocrine and endothelial, and M2 receptors are present in the heart, and M1 receptors are present in C for CNS, and A for autonomic ganglia, and G for gastric cells, gastric glands. And next, M4 and M5 are left. These two are present in CNS. So moving on to the functions, as you all know, M3. So M3, see the huge cage. So first one is smooth muscle. So smooth muscle, it contracts. Its function is contraction, and then again you have SE. E is endocrine glands. So in endocrine it does secretion, and then you have I, that is constriction of pupillae and contraction of ciliary muscles occurs. These are the functions of M3 receptors. Whereas M2 receptors, so it's huge, that is heart. It decreases the heart rate and decreases the heart conduction. And moving on to the M1, that is see the huge cage. So C for it's CNS, so learning and cognition. And then you have autonomic ganglia, and it causes depolarization. Ganglia. And in gastric cells or gastric glands, it causes the histamine release and acid secretion. So these are the functions of M1, M2 and M3 receptors. As you know, M4 and M5 are present in CNS, and it also helpful in learning and cognition. So now we are going to see about muscarinic receptor blocking agents. So you have to remember about muscarinic receptor blocking agents. You have two categories. One is naturally occurring alkaloids, and second one is you have semi-synthetic ones. Now moving on to the naturally occurring alkaloids. Atropa belladonna and scopolamine are usually obtained from certain plants like Atropa belladonna plant, and you have datura plants. The interesting fact about belladonna is nothing but a pretty lady. You can remember this so that you can remember its function. That's why I'm telling this. In ancient times, the ladies use this Atropa belladonna extract to make the pupil dilate, and it makes the eyes to look bigger. As you know that muscarinic receptor's function in the pupil is to constrict the pupil. Since it blocks the muscarinic receptor, it dilates the pupil and makes the eye bigger. So dilation is a fact here, dilation of pupil. So this is how it acts. And so how it acts on the receptor is, there occurs a competitive antagonism, that is acetylcholine usually act on the muscarinic receptor. It's an agonist for muscarinic receptor, whereas now atropine will competitively inhibit, will compete for the acetylcholine, compete for the muscarinic receptors, and competitively inhibit the muscarinic receptor. So this is how it blocks the receptor. Dose of atropine is very important. Since it varies from organ to organ, you must remember its dose. So how much dose is required for which organ affects with lesser dose. So with lesser doses itself, atropine blockade is very much effective in salivary secretion and the bronchial secretions. So with lesser doses itself, atropine blockade is heavier in these regions, whereas in heart and in eyes and in gastric regions it is less. It's not much effective even in larger doses. So lesser doses is enough for this salivary and bronchial secretion inhibition blockade, whereas even in large doses atropine blockade is less in these areas. And now what happens in larger doses? What happens when atropine is given in larger doses? So atropine usually blocks the muscarinic receptors, but in larger doses it blocks the nicotinic actions of acetylcholine 2. And that leads to other areas. So moving on to the pharmacological actions. So pharmacological actions will be easier for you since you know their locations, muscarinic receptors locations. So first one is that is smooth muscles. M3 receptors are found in smooth muscles. So usually they increases the tone since it blocks the muscarinic receptors. Atropine and scopolamine blocks the muscarinic receptors. It decreases the tone and mobility. So it decreases the tone and mobility. So it can be used as yes, it can be used as antispasmodic. So it's being used as an antispasmodic, and then it also relaxes the smooth muscle, bronchial smooth muscles. So can it be used in asthma? You'll find the answer within 2 seconds. Moving on to next one, eye. So it causes dilation of pupil. So mydriasis, it also causes photophobia and cycloplegia. There's nothing but it happens due to the paralysis of ciliary muscles. And it causes loss of accommodation. So moving on to the secretions. Since it also helpful in, it is also present in endocrine glands, and it's also helpful in managing the secretions. It causes dryness of mouth by blocking the muscarinic receptors, and it also reduces the secretions of gastric enzymes, and it also reduces the bronchial secretions. So since it reduces the bronchial secretions, it cannot be used in asthma. Even though it relaxes the bronchial muscles, it cannot be used in asthma since it reduces the bronchial secretions. So next, moving on to CVS. So M2 receptors are present in CVS. So normal function is it reduces the heart rate. Since it blocks the muscarinic receptors, it increases the heart rate. But the heart rate increase is seen much in young adults because M2 receptors are profound in young adults, whereas in old and pediatrics it is not found. So increase in heart rate will not be visible in old and pediatric patients. And we move on to the CNS. At moderate doses, it reduces even tremors and rigidity in Parkinsonism. So these are the pharmacological actions. The detailed note on the atropine and scopolamine. When you compare atropine and scopolamine, scopolamine depresses the reticular activating system. So you will be knowing the role of reticular activating system in sleep and wakefulness. Since scopolamine suppresses the reticular activating system, it produces a dreamless sleep, and it also causes drowsiness. And when you compare scopolamine and atropine, scopolamine is found to be more toxic than atropine. Next, moving on to lethal doses of atropine. 10 to 20 mg is the lethal dose, known lethal dose for children. Whereas more than 200 mg is found to be the lethal dose in adults. And coming to the pharmacokinetic parameters, the T half of atropine is just 4 hours. So half of the drug to get eliminated is 4 hours. And how will you detect atropine poisoning? So how will you know that the patient is poisoned with atropine? Is by taking the patient's urine sample and putting it in the cat's eye. The cat eye dilates. This is how you will be finding it's an atropine poisoning. Not in every cases that there occurs a dilation of pupil. In some cases you have to identify by using the characteristics of the patient, like CNS effect. And now moving on to the interesting topic, that is indications. So where all this atropine, alkaloids and scopolamine are used, where are these natural alkaloids are used, where are these muscarinic receptor antagonists are used. So by again coming to the previous one, like mnemonic, see the huge cage. With that mnemonic itself, you will be finding out the answer for its uses. So smooth muscle. When you say about smooth muscle, you have to think about gastric and urinary. So gastric smooth muscle, so it you know that it's used as an antispasmodic. So it's used in colic pains, colicky pain. So gastric colic pain and even renal colics, atropine is used. And when you compare to the urinary region, you know that it retains the urine, and so it is used in urinary incontinence. It enhances the detrusor muscle, and so it causes urinary retention. So it's used in urinary incontinence patients. And then moving on to the eyes, as you all know, it dilates the pupil. So since it dilates the pupil, it's usually used in fundoscopic examinations. So in fundoscopic examinations, they usually dilates the pupil. And even in iritis, for dilation of pupil, this atropine is used. And moving on to the secretions, as you all know, it suppresses the bronchial secretion. So for pre-anesthetic medication, so atropine is used as a pre-anesthetic medication as it reduces the secretions. And moving on to the CVS, it abolishes the AV block due to vagal activity. And CNS, you already know, it is useful in treating the tremors and rigidity in Parkinsonism. And the another important one is poisoning. That is, you know about organophosphorus. So organophosphorus are nothing but they are anticholinesterases. So when there occurs a poisoning due to organophosphorus, this atropine is the main agent to treat atropine, that is organophosphorus poisoning. The main indications are, which are used now, is AV block. Important indications is to abolition of AV block, and next one is in organophosphorus poisoning, and next one in urinary incontinence. These are the three major indications of atropine. Synthetic and semi-synthetic ones, that is muscarinic receptor blockers. So oxybutynin and tolterodine. Oxybutynin and tolterodine are the two drugs which are used in the treatment of urinary urgency. So since it causes urinary retention, it's used in urinary incontinence. So oxybutynin and tolterodin. And next, scopolamine is used to relieve pain. And scopolamine, cycloamine, propanthelin. So two amines, that is MINE and propanthelin. So these three are used mainly in pain. So methylscopolamine is used in colic pain, renal, especially in renal colics. And dicycloamine is used in dysmenorrhea, and that is painful cramps. And propanthelin is used in diverticulitis, and in IBD, that is inflammatory bowel diseases. One is overactive bladder, hypertonicity, and nocturia. So in these three conditions, there will be an urinary urgency. So various factors are associated with urinary urgency, and so in these cases also our muscarinic receptor blockers are used. Apart from this muscarinic receptor blockers, other drugs used are Botox, which is used as an IM injection, and mirabegron, which is a beta-3 adrenergic agonist. It's also used in the treatment of overactive bladder. So what happens after menopause also, there occurs a urinary urgency, you would have noticed. So degeneration of estrogen receptors, this is due to the degeneration of estrogen receptors. In these cases, what may be the treatment? So estrogen therapy. So vaginal estrogen therapy is used. These are about the other drugs. What are the points to remember? See the huge gauge is the important mnemonic you have to remember. With these mnemonic, you can write the pharmacology, you can write its actions, you can write its indications, and you can remember too. So, and next one is it's not used in asthma since it reduces the bronchial secretions, and it aggravates glaucoma because it causes paralysis of ciliary muscles, and it causes cyclopegia. And even with congestive heart failure patients with tachycardia, it should not be used because it increases the heart rate. So that's all about atropine, that is muscarinic receptor blocker. And we saw about atropine, scopolamine, synthetic and semi-synthetic agents, and about the overactive bladder. Thank you for watching. Just follow the Instagram page. Thank you. Have a nice day.